many people could have underlying reasons why they've used alcohol or other drugs, and they may be part of another illness. So, for example, mood disorders, depressions, bipolar disorder, a lot of other illnesses could have some kind of relationship to why the person began using substances. It may be self-medication. It's usually very important to address the addiction first, because you can often find that, particularly most of my experience with working with people with alcohol problems anyway, was that they sometimes, in fact more often than not, if you managed to deal with the addiction and you got them abstinent, say after a month or so, a lot of their depressive symptoms would have changed. So you need to then think again about whether or not they need to be treated with medication, because it's really important to get that right. And some medications that are used for depression could make the addiction worse. So in my experience, it's really important to actually, first of all, address the addiction problem and support them and get them as stable as you can before you go back and look again at the mental health issue.
In my caseload, I will often have patients who have a dual diagnosis. So the addiction will coexist with another mental health problem. And if these patients are suitable for CBT, then I will use this approach to work with the coexisting problem. So in the past, I have used CBT to work with patients who have social anxiety, generalized anxiety with tendency to worry, patients who have low self-esteem, anger problems, depression, and eating disorders.
Well, they suffer from just about any medical illness that you could think of. You know, they have liver disease, everybody thinks about that one, or brain disease, memory problems, permanent brain disease, nerve problems. They also have heart problems. Basically, any system in the body is affected. So you would see a lot of coexisting physical illness, and of course, often you'll see a lot of coexisting mental illness. A lot of people will have depression, or pretty much any psychiatric illness can go alongside addiction.